Welcome to Watch Your Mouth, the podcast by the Ministry of Health and Wellness Oral Health Unit, where we straighten out the facts about oral health. I'm your host, Dr. Chanel Dempster-Peart, and today we have a special guest who knows a thing or two about making smiles shine, Dr. Suzanne Grey. Dr. Grey's orthodontic journey began when she was just 6 years old, traveling 2 hours each way each month from Mandeville to Kingston for orthodontic care, thanks to her dentist dad's insistence. This sparked her passion for orthodontics and highlighted the need for more accessible orthodontic care in her community. With degrees in civil engineering, public health, general dentistry, plus orthodontic training, she brings a wealth of knowledge and a dash of enthusiasm to her private practice. Today, we'll dive into the world of aligners, braces, and all things orthodontic, exploring why proper orthodontic care is crucial for everyone. Dr. Grey, thanks so much for joining us.
Thanks for having me.
Tell me, what exactly is orthodontics?
So orthodontics is one of the specialties within dentistry that really deals with the diagnosis, treatment, prevention, and management of misaligned teeth. So really what we concentrate on is essentially fixing the bite. And the jaws do come into play because in fixing the teeth that are both housed in the jaws, we can also alter your face. So really, we in addition to creating smiles, we also create faces.
Okay. So what are the options available to straighten your teeth? Is it only braces?
So originally, it was only braces, but there has been some newer modalities that have come on the market, like there are a lot of clear aligner options, to include the most popular one that you probably hear about commercialized a lot, which is Invisalign. There's also, we now have lingual braces. And then in some cases, things can be fixed very simply with small retainer movements. So those are really the options. We're talking about clear aligners, lingual braces, the traditional braces, which is what most people have. And we can also move teeth somewhat with retainers.
Okay, so you said it's more than just fixing teeth, more than just the smile. We're also fixing faces, moving the jaw. So orthodontics is more than just a beautiful smile, it sounds like.
Yes. In essence, what we do is we fix malocclusions. So that is malocclusions. When we say that, we're talking about a bad bite. Sometimes cases can be a little bit severe and might not only require braces, but might also require some help from the oral surgeon to actually move and align the jaws into the right position, along with the braces, to really give you the right bite at the end.
And the bite is important for function. There's been a trend about these fashion braces marketed by unlicensed individuals, especially here in Jamaica. Can you explain what these are and if there are any risks associated with it?
Okay, so what fashion braces is the same material that we use to straighten teeth, the same brackets, the same wires, are put on patients. So there are kind of 2 ways that people go about doing this. There is the DIY or the do it on your own kind of option, where you can purchase them online and look at some instructional videos and figure out how to put it on. And then there's also some individuals who have kind of commercialized this and starting to put it on persons with the same brackets and the wires that we use in orthodontics, except they don't have the technical knowledge in how to deal with these kind of cases. So really at the end of the day, when they put it on, it really does do the same job that we do, but it's being done by someone who doesn't know really what they're doing. So at the end of the day, what tends to happen is you're putting on the braces, but it's moving the teeth, but it's not moving it with the person moving it doesn't have the knowledge to know how to move it. So a lot of times what you tend to find is, they come into my practice and they have teeth that are out of position, or teeth that because they've moved the teeth so far it's not out of bone. You can lose teeth because of this. So there are a lot of risk, and not only that, but a lot of times when they go to these persons that put on these braces, they put it on and there's no maintenance because they really don't know how to maintain it. So patients will come in and they can get mouth injuries and mouth sores because their wires and their brackets, and it can cause infection and stuff, especially if it's not monitored properly.
That does not sound safe at all. And I imagine that because they're working in the mouth, a highly infectious area, that these persons should be trained and know how to prevent further infection in the mouth. But suppose the public wants to find a licensed person. How would they be able to identify that this person is licensed, registered, and fit to be putting on orthodontic or carrying out orthodontic treatment?
So typically, there's not a lot of us here in Jamaica. It's actually the biggest dental specialty in Jamaica, but there's only maybe about 4 or 5 practices that specialize in orthodontics. There are some dentists that do put on braces, and that's okay too. But if you're trying to seek out an orthodontist specifically, they should be registered by the dental council. Usually, if they are, when you walk into the office, usually their license is on display. Also, we all have websites that has our history, where we went to school, our background, all of that stuff. So you really have to kind of delve in and do your research. Everybody has Instagram and Facebook handles, but usually if you go to one of those sites and you don't really see the doctor on there, more than likely they're probably not selling an authentic product, just because of privacy issues. We don't typically show like before and after or stuff like that, or you're not going to see a lot of faces. But for the most part, you need to make sure that they're registered with the dental council. So you can ask those questions when you make the call to the office. Is your dentist registered with the dental council? If the answer is no, you probably don't want to go there for braces. I think that's the big number one. And then also, if you're looking for an orthodontic specialist, as I said, there's not a lot of us in the country, but we all have websites and you can see the training. And typically, our orthodontist goes to 2 to 3 years of residency after the general dentistry program to have that specialty.
Okay. So this professional group, though limited, is open and willing to treat the public. But I understand that sometimes the reason a person may choose these fake braces is because of a cost factor. Could you speak a little bit more about how it is persons can access this care in terms of the financial responsibility?
So I think if you choose as a patient to go, or even for your child to undergo an orthodontic journey, you have to understand that it's an investment. It's not something, orthodontics is not something that you go in today like a filling, you get it done and you come out and it's done. It's a 2, sometimes 3-year process. And because of that, it tends to be a little expensive. As I said, most of the orthodontists here in Jamaica, where a lot of our products and stuff we get from overseas, so we have to bring them in, we have to ship them, we have to consider the fact that we have to have a fully staffed team. The staff have to be there all the time. Even now I'm not at my office, but my staff are there to handle emergencies, to deal with patients. So those things are important when we start to think about the cost factor. Now, everything that we do quote usually tends to be in US dollars, because of the fact that we get a lot of our stuff from overseas. I would say on average, anytime anybody asks me, I say on average braces will cost about 6,000 US. But we do have payment plans. You don't pay it all at once. You pay it over the course of treatment, because it's not something that takes a day and you're done and that's due on the day. It takes a time and it is a journey. So that average cost is really broken down over the course of your treatment to help to make it a little bit more affordable.
Okay. So this journey, are we talking about 6 weeks, 6 months, 2 years? Any average
I
time?
would say the average treatment will take about anywhere between 15 to 24 months. But then there are some difficult cases that take 3 years, 4 years. But on average, I would say anywhere between 15 to 24 months, depending on what's happening.
So it's really a journey.
It's yes,
Yeah, it's
yes.
really a
And
journey.
it's not one appointment, it's several appointments. So you have to consider all of that when you think of the price.
Or the investment.
And the investment.
The
Because I always tell
investment.
patients, when somebody chooses to go through this journey, it's really an investment you're making in yourself or your child. So really, you want to make sure that one, you're doing it with the right person, and two, that you're really committed to the whole journey and not just to put it on today and don't go back again, because it doesn't work like that.
Yeah, and this investment is in their health as well.
Yes.
So we've spoken about going through this journey, getting orthodontic treatment, but are there any potential long-term effects, short-term effects on oral health if someone who needs orthodontic treatment decides to forego this sort of care?
Sure. So, I see it a lot of times, especially in cases where teeth are really badly malpositioned, where they're not able to maintain their oral health very well. They might not be able to floss in between teeth. They may not be able to brush properly in between teeth. And then these teeth end up being curious or getting cavities and eventually might have to be taken out because of these reasons. So really, what should have happened to this person is that they probably should have straightened their teeth out so that they could now take care of it for the long term. So what I would say is malpositioned teeth tend to be a little bit more difficult to cure. Hence why, you don't really want to delay, but I understand some people do have to delay. But keeping them, even if they're malpositioned, clean until you can straighten them out is going to be very essential.
Okay, so malpositioned, a big word telling us that they're not in the right place. I hear you saying they're difficult to floss, like when persons have those crowded, overlapping teeth. Those teeth we call riders. And then the other side, too, I know about is sometimes teeth may protrude a little and there may be risk of injury. Could you tell me a little bit about that as well?
Definitely. So, protruding teeth tend to be when a child falls, or even adults sometimes falls, tends to be the first thing that they hit. So, we see time and time again where a child comes into our office and they're falling and they hit the front teeth. And a lot of times when they hit the front teeth, sometimes it can lead to the tooth eventually becoming what we call dead or needing a root canal and some kind of repair in order to get it back to, or at least in a good position. And I think some of the reasons why that happens is because the teeth stick out too much. So a lot of times in orthodontics, what we'll do is we will sometimes take out teeth in order to bring the teeth back into a position that is better for the lips and better for the gums, and also in a position so that they don't protrude out as much, to be in more of a normal position in relation to the jaws so that the person can function a little bit better.
Yeah, sounds like it's more than just pretty smiles. Definitely important for our health. At what age do we want to encourage the public to start seeking treatment for orthodontics?
So what we recommend now is that 7 is typically the age where a child has their permanent front teeth, both upper and lower, and their first molars. So we do encourage them to come in at age 7 so that we can just take a look. Typically in most cases, what we're doing is taking a look, taking certain x-rays to just ensure that all the teeth are there and to determine if there's any kind of intervention that we'll need to do at that point in time. So typically when you're going at 7, not all the time is that, let's get this child started. But at the same time, we take a look to kind of warn you as to, hey, this tooth might not be there, so we're going to have to start to think of options. Or in some cases, we'll go in there and do some in limited orthodontics, interceptive orthodontics, to try and correct things like underbites, so that they don't manifest into something that might be potentially worse once the child reaches 12, which is typically the age where most teeth come in, permanent
Okay.
teeth.
So with that early visit, 6, 7, in your introduction, we spoke about you coming to Kingston at age 6, and you're saying by 7 the children need to be in. That can help to have other options, you're saying. That
Yes.
sounds good. Are there any common misconceptions that people may have around braces and orthodontic care that you'd love to just speak about?
Sure. So the number one thing is that braces do not set off metal detectors. Right? So don't worry about it. It's made of really light material, so you don't have to worry about going through any metal detectors and it not alarming anybody.
Okay.
I think another thing is people think once they have braces that their journey is over. The teeth are straight, they stay that way. Well, that is not true. You have to wear your retainers. It's so important for you to wear your retainers. And we used to tell patients to wear it for a year, full time, a year after, and then you can forget about it, but it doesn't work like that. Your teeth will move, your teeth will always tend to want to move back to its original state, so you have to wear your retainers. It's not end all be all. Another thing, another misconception is that, orthodontics is for kids. It's not. I mean, I think in this day and age, I think we're starting to see a lot more adults opt for things like clear aligners and braces, but it's not something that once you pass a certain age, you're not able to access anymore. And now we're doing it for different reasons. So now, we'll have a lot of cases that we do braces and we work with the general dentist or the restorative specialist to try and get the patient some more teeth. We have some older cases too that just need straightening, but a lot of these cases with older patients tend to be what we call multidisciplinary cases. So it might involve some of the other specialties, and we work really well with the other specialties to get the end product, which is a beautiful smile.
Yes, yes, and great oral health. I know you said it's not only for children, but for parents who are navigating this decision-making process for their child's orthodontic treatment. Is there any, they might be tempted to look at the quick fix. Do you have any words for them as they make those decisions?
Sure. So I think, the first thing is you really do want to go to a licensed professional, whether it's an orthodontist or a dentist. And as I said, some dentists do braces, and that's fine. But the ones that don't will refer you to an orthodontist if they see it fit to go to a specialist to get braces placed or aligners. Another thing is I think you have to be comfortable with where you're going. As I said, braces is a journey. And for me, when I was younger, I had to drive 2 hours. So, and this is every 48 weeks you have to go. And if you have an emergency, you have to go to the office. So you want to find a place that's convenient for you. Unfortunately, right now in Jamaica, we don't have an orthodontist in every parish, but I'm sure right now that people can access the closest orthodontist or even dentist that does braces to get that treatment journey started. I think you have to really know that you have to be able to access the office, because I have a lot of patients that will start with me, and because I might be in a certain locale cannot continue. So one thing I really don't like is when a patient starts with me and just cannot come back in. So if it's hard for you to get there, you might not want to do it then and there. I have patients that ask me all the time from overseas if they can come and start with me, but they're going to go back overseas. And I always tell them, please don't do that. Please don't waste your money. So you have to be in a place that's accessible and that that you can get to if you have an emergency or or even just for your maintenance appointments.
Okay, interesting. Persons want to try and do their orthodontic treatment from overseas. All right. It sounds like adults having missed opportunity when they were younger. They are trying to make up for lost time and want to do that with someone licensed, qualified, get to good oral health, position their teeth nicely, take care of their jaws. Is there anything you'd want to say to the adult group in particular when they're making decisions?
You know, I think I think your braces journey is an incredible journey, and I think everybody, unless you have like really amazing teeth, should have that chance to experience it. And unfortunately, for different reasons, not everybody is able to experience it. But it's never too late. It's never too late to fix your smile. It's never too late. I mean, you wear your smile every day. It's something I think that people should aspire to if it is that they have issues with their teeth and the way that they're positioned. So I would encourage you, if you're an adult and you don't like something about your smile and you know it's because of the way that the teeth are positioned, to just do a consultation. I mean, it doesn't hurt.
Yeah.
You know, do a consultation, find out if you can fix these things, because as I say, it's something that, you know, we take for granted. I mean, you know, but I mean, this is how we define people sometimes in Jamaican society. I mean, you call that person buff teeth, or you call that person space teeth, or you know, so, and sometimes it creates stigmas. So if it is something that you don't like and you want to fix, I would definitely recommend you to come in, do a consultation, because it's never too late.
It's not too late. Well, Dr. Gray, on this show, Watch Your Mouth, we ask each guest to give us a word, one parting word, like a last lick. What's yours?
Okay, so because they made this episode really part of it to address fashion braces, I told them that my word was rubbish. So when you think about fashion braces, think rubbish. A waste of time, and really it's something that you should not consider.
What a last lick, rubbish from fashion braces. Dr. Gray, thank you for joining us today. Thank you for taking time from your busy practice. I hope that those listening would have learned something. And thank you for tuning into this episode of Watch Your Mouth with our special guest, Dr. Suzanne Gray. We've explored the critical differences between real orthodontic care and the risks associated with unlicensed alternatives, as well as, more importantly, the fact that braces are for a healthy smile and a healthy jaw. Remember, investing in your oral health is an investment, yes, and it's one for your overall well-being. So until next time, watch your mouth. And remember, a happy mouth is a happy body.